now you're probably sitting at your desk, just like I'm sitting at my desk here at home, but I want you to stand up for a second and copy the position that you see here on the screen. This is your very first bit of anatomy and physiology terminology, or really the starting point for learning all of that terminology. It's what we call anatomical position. So you should be standing with your feet roughly shoulder length apart, your arms kind of hanging at your sides with your palms facing forward and your thumbs facing away from you. This is our starting point. When we look at all of the other terminology, the reference for it is always this here, an anatomical position. The reason we need anatomical position is we have to have a common frame of reference, right? If I'm speaking Greek and you're speaking Italian or Farsi or something like that, that doesn't really help us, right? We need to have a common language and a common starting point to that language, and our common starting point, our reference, is always this here, an anatomical position. So whenever I ask you a question about the different terminology, always picture anatomical position in your brain. And sometimes you may even want to like pretend that you're the figure in the book. I still do that sometimes too. So we're gonna use what we call orientation or directional terminology to describe the way body parts are kind of organized on the body. Again, always referencing an anatomical position. The great thing about these directional terms is they're kind of in pairs. So if you know one relationship, you can infer the other relationship. So we'll start with a couple of the easy ones. Superior and inferior, anterior and posterior. Sometimes we'll substitute cranial for superior and caudal for inferior, but essentially we're talking about above and below. Towards the head, cranial, towards the tail, caudal. So think of the head and the abdomen, right? So the head is superior to the abdomen. That makes the abdomen inferior to the head. If we look at the belly button, like in the navel area, right? The navel is inferior to the chin, so the chin would then be superior to the navel. Again, if you know one relationship, you can infer the other. Anterior or ventral is the front of the body. Posterior or dorsal is kind of behind, like the back of the body. So the breastbone is anterior to the spine. The heart is posterior to the breastbone. Make sense? Then along a horizontal direction, we have the terms medial, lateral, and intermediate. Medial is towards the midline of the body. Lateral is away from the midline of the body. So the heart would be medial to the arm. The arms would then be lateral to the chest or the trunk. Now you'll see that in all of these examples that we've used, we've just had two frames of reference, right? Two body parts that we're referencing. But we could also use the term intermediate if we have three reference points. So the collarbone is, you can palpate it. It's the bone here on the go towards your breastbone in the middle of your chest, and then kind of walk your fingers laterally towards your shoulder, and that is your collarbone. So the collarbone is medial to the breastbone. Excuse me, it's medial to the shoulder, but lateral to the breastbone. We could also just say that the collarbone is intermediate to the shoulder and the breastbone. It's essentially just a fancy word for between. Before we cover proximal and distal, we're going to do superficial and deep, external and internal. So superficial organs are more towards the body surface, so they're more external. Deep organs are away from the body surface, so they're more internal. So the skin is the most superficial organ on your body, and pretty much everything else is then deep to the skin. So all of those terms I don't think generally students have an issue with. The terms that students usually get hung up on, if they get hung up on one, are these two terms here, and that's proximal and distal. So proximal and distal are used to describe body parts typically in the limbs, not on the trunk. If we're on the trunk, we typically will use superior and inferior or anterior, posterior. But go into, stand up again and go into anatomical position. I want you to look at your elbow and your wrist. If you were in anatomical position and you were to say that the elbow is superior to your wrist, the elbow is above the wrist, would that be incorrect? Well, no, it wouldn't be incorrect. Yes, the wrist is above the elbow. The elbow is above the wrist in anatomical position, but it's not the most precise term that we can use. And precision matters in anatomy and physiology. So the more precise term would be to say that the elbow is proximal to the wrist, because the elbow is closer to the trunk than the wrist is. That would make the wrist distal to the elbow. Look at your lower limb, right? Look at the knee to the thigh, right? You could theoretically say the knee is inferior to the thigh. Yes, the knee is below the thigh, but again, not the most precise term. A more precise term would be to say that the knee is distal to the thigh, because the knee is further away from the trunk, further away from the point of attachment to the trunk than the thigh is. And that is the one that students usually get hung up on, proximal and distal. The other ones I think kind of make sense. External, internal, superficial and deep, anterior, posterior, medial and lateral, superior and inferior. But the best way to do that, the best way to practice with all of these is to just pick out some body parts on your body. Just randomly pick out some body parts and describe the relationships of those body parts. Typically, we break the body into what we call the axial body and the appendicular body. So the axial regions of the body are the head, the neck, and the trunk, and then all of the body parts kind of therein. And then the appendicular part of the body refers to the limbs. Within the axial body and the appendicular body, we then have all of these various regional terms that designate all these different kind of areas within these body divisions. It's about 40 or 50 terms. Many of them are Latin in origin and or Greek in their roots. Many of them are named for bones or parts of bones that are in those area. So for instance, the thigh is actually the femoral region. So guess what the bone of the thigh is? Well, it's the femur. The coxal bone is the hip. So it's the coxal region, which is your hip region. The acromial region is this back part of the shoulder. Well, there's a part of the shoulder bone called the acromion. So the terms here are very much either bones or parts of bones, blood vessels, and I wish I had a trick for you guys. You can play Simon Says, if you ever played Simon Says when you were a little kid. If you have kids in your life, actually kids make great little study buddies. They make great little models. Get yourself a little butcher block paper or a poster board, make yourself a body outline, and just practice. There isn't a shortcut. I really wish I could tell you guys that there was a shortcut, but there isn't. You just have to practice, and use your body. That's one of the great things about studying human anatomy and physiology. You are a human being. And so as you go over, let's do some of the parts of the head, right? So the frontal area is the forehead. You can actually touch your forehead. The orbital area is your eye sockets. So you can touch your eyeballs. The nasal area is your nose. So you can touch your nose. The buccal area is your cheeks. So go ahead and touch your cheeks. The oral region is your mouth. You can touch your mouth. The mental region is your chin. So go ahead and kind of palpate your chin there. So use your body and kind of palpate all of these different regions. Or again, play Simon Says, or do a body outline. Get a doll or like a plastic little skeleton or something like that, or if just a like Cabbage Patch doll, a little baby doll, that works too. But practice and use your body as you practice. It's there, so definitely try to use it. So you definitely want to practice with the anterior terms and the posterior terms. And again, I really do wish I could give you guys a trick, but you just have to kind of learn it. The other bit of terminology that we have to cover are planes and sections. So a body plane is essentially this flat surface upon which we cut an organ or a body part, typically so that we can look at some of the internal structures. So there's kind of imaginary lines. When we cut along those body planes, then we have a section. So the types of sections that we typically have are cross sections, longitudinal sections, or oblique sections. Depending on which body plane we cut, that will result in the longitudinal cross section or oblique section. So the three most common body planes are the sagittal plane, the frontal or coronal plane, and the transverse plane. The median is actually mid-sagittal, so it's an equal parts right and left. You can also have parasagittal, which would be kind of unequal parts right and left. So if you were to cut your body right down the middle, that would be a mid-sagittal plane or a median plane. If you were to go off to the side a little bit and cut down, say through a breast and part of your thigh, that would then be a parasagittal plane, unequal right and left. The frontal or coronal plane cuts the body into an anterior section and a posterior section. Both the sagittal plane and the coronal or frontal plane result in what we call longitudinal sections of the body, meaning they go with the long axis of the body. When you cut along a transverse plane, you get what we call a cross section, because essentially you're looking across the body. Part of the reason understanding body planes is super important, and you have to pay attention to which body plane you are looking at, is all three of these images here are sections through the trunk. And yet, depending on the plane upon which the cut was made, different organs are visible. The organs themselves look different. I mean, here's the vertebrae in a mid-sagittal section versus the vertebrae here in this kind of transverse cross section. It's the same organ, it's a vertebra, but it looks really, really different. And so you do have to pay attention to the various body planes and the resultant sections. The last one I mentioned, which was an oblique section or an oblique plane, it's essentially a cut that's not any one of these three. So at any angle other than these three that are at right angles to each other. But these three are by far the most common that we use: sagittal, frontal, and transverse. The other bit of terminology is kind of the spaces within the body. That's what we call cavities. A cavity is essentially just a space that houses some organs. The two major body cavities are the dorsal body cavity and then the ventral body cavity. The dorsal body cavity is then further subdivided into the cranial cavity that contains your brain and the vertebral cavity that contains your spinal cord. The ventral body cavity is broken into the thoracic cavity and the abdominopelvic cavity. The thoracic cavity is then further subdivided into two pleural cavities that contain your lungs, a pericardial cavity that contains your heart, and then what's known as the mediastinum, which is kind of that middle portion of the thoracic cavity. The abdominal pelvic cavity is broken into the abdominal cavity, which contains most of your digestive viscera, all of your intestines and your stomach and your liver, and then the pelvic cavity, which contains most of your urinary organs, things like the bladder, as well as your reproductive organs. The ventral body cavities, the thoracic cavity and the abdominal pelvic cavity, are lined and covered in these membranes that are called serosa. They're these very thin, kind of double layer membranes that essentially create a lot of friction reduction. So think about all of the organs that you have shoved up in your abdominal cavity, right? If they would rub against each other, that would create a lot of friction. And so rather than having that occur, the body has all of these really smooth, slick serosa membranes that cut down on a lot of that friction. So essentially imagine what you're going to do is you've got a balloon here, and if you carefully, a water balloon, right, carefully shove your fist into the water balloon, that will give you kind of the general idea of these two-layer membranes with the fluid-filled cavity kind of between them that's filled with this serous fluid that's made by both parts of the wall. So the parietal layer is what actually lines the cavity itself, and then the visceral layer is what actually kind of clings to the organ. So let's take a look. We've got the pericardium, the pleurae, and the peritoneum. So the parietal pericardium lines the pericardial cavity, the space in which the heart sits. The visceral pericardium actually clings to the heart itself. The parietal pleura lines the pleural cavities in which the lungs sit. The visceral pleura then cover the lungs themselves. The parietal peritoneum lines the abdominal cavity. The visceral peritoneum covers all and separates all of the organs in the abdominal cavity. So those are our serous membranes. We do have a couple other body cavities in the body, some which are exposed to the outside environment and some that are kind of internal. The internal cavities are known as synovial cavities. They are our joint cavities so that we can move our body around. The oral and digestive cavities are exposed to the environment. It's how we get food into our body and then out our body. The nasal cavity, we're talking about the nasal region. The orbital cavities are your eye sockets, and then you have cavities in your middle ear where you have 3 tiny little bones that help you hear.